Dr. Payal Kohli, our 9Health expert, joins us to talk about some of the explanations that we're seeing. Good morning again. So what are the possible reasons we're seeing declining hospitalizations like states like Texas, Arizona? They're reporting record highs.
There are many possible reasons for this. So the first and probably the biggest driver of this, Gary, we've talked about before, which is the fact that probably us as Coloradans were better behaved during the month of May. We had fewer of those large Memorial Day gatherings, our bars were not open, and probably we were wearing masks for the most part. So I think that's the biggest contributor. But there are other possible scientific explanations. So the second reason is that the population in Colorado generally tends to be healthier. If you think about Denver and Boulder, they're two of the fittest cities here in the United States. And because the population is healthier, they're less likely to end up in the hospital with severe COVID-19. And we know that that's true. The third reason is the types of recreation that we as Coloradans like to do. So we like to indulge in outdoor activities for the most part, as opposed to some other states where a lot of the recreation is indoors. And we know that the spread of the virus is much less efficient when you're outdoors. And the last, and I think most interesting reason, is the possible effect of altitude actually slowing the spread of the virus.
Yeah, talk a little more about the altitude thing, because I think that's interesting too. You know, our first cases were at altitude. They were in Eagle County, and they were big numbers.
Exactly. Yeah. So it's not the case that it doesn't spread at all at altitude. And probably what happened with those first cases was that we had a super spreader event where somebody from out of town came in and brought the virus to us. But epidemiologic studies from the mountains of Tibet and high altitude regions of Bolivia and Ecuador actually show an inflection point, as shown on this graph, at 2,500 meters, which is about 1.5 miles above sea level. So just a little higher than what we are here in Denver. And what you see here is a digital model of the prevalence based on altitude. So the density of the bars tells you how many cases there are. And you can see that as we get to higher and higher altitude, there's really a lower prevalence of cases, and those bars become really widely spaced out. Now, you may be wondering why altitude has these types of effects, and there's two possible explanations. So the first is environmental explanation. When you're at higher altitude, you actually have more UV light in the atmosphere, which serves as a natural sanitizer, so to speak, for the virus. So you actually reduce the half-life or the survivability of the virus in the atmosphere. And then the second possible reason is host factors. So because you and I live here at altitude at 50 to 80 feet, we actually have changes in our lungs that cause downregulation of the ACE2 receptor. Now remember, that's the doorway that the virus uses to get into the lungs. So if you have fewer doorways, you're less likely to have the virus get into your lungs.
Just another reason why we're really lucky to live where we do, I guess. All right. Dr. Payal Kohli, thank you as always. We appreciate it.